Then the Ghana Registered Nurses and Midwives Association has called on government to, as a matter of urgency, halt the reintroduction of the community health workers, Zoom nurses. This comes after the association's attention was drawn to a memorandum of understanding signed between the Ghana Health Service and the Youth Employment Agency, YEA, for the reintroduction of the modular 6-month training of community health workers. We'll hear from them shortly, but last week the Youth Employment Agency, in collaboration with the Ghana Health Service, announced a 1 million jobs initiative beginning the Community Health Worker Group program. According to Deputy CEO of the YEA, Alhaji Ibrahim Bashir, the initiative is part of efforts to augment the fight against COVID-19 in Ghana. Now, Ghana will provide quality healthcare delivery services, especially to rural communities, with this YEA agreement that has been signed.
Couldn't have had a better time to do this than an era where the whole country is bedeviled with this pandemic and this monster called COVID. And so it is the hope of the Youth Employment Agency and, of course, the Ghana Health Service that these young people will help in the fight against COVID. Like the Corporate Affairs Director intimated, if you check our rural communities today, it does appear there's people who still believe that there's nothing called COVID. And I believe the only way we can get people to believe that there's COVID and for us to actually respect the protocols, we'll have to do a lot of education. We need to educate people. I recall somebody was interviewed on TV, and he said that he wants to see COVID with his naked eye. And his estimation is something that is visible. And I think that if we get these young people to the rural communities, our KIPS compounds, our health facilities, our clinics, the polyclinics, it will augment the staff strength of the Ghana Health Service so that together, as partners in development, we'll make something very meaningful. I want to also add that the Youth Employment Agency is particularly excited that today we are going to sign an MOU that will lead to the creation of about 3,000 jobs. First of all, the purpose is to create jobs, and secondly is to help in the fight against COVID, and also to help our health facilities that are under pressure now.
Now, Director of the Ghana Health Service, Dr. Patrick Kumabo-Adjei, who signed a memorandum of understanding with officials of the YEA, explained beneficiaries of this initiative who prove themselves worthy will eventually be absorbed into the Ghana Health Service.
The team will be doing, among other things, education. They'll be providing information on rumors, outbreaks of diseases, and many other things, including sometimes distribution of certain essential basic commodities that the community needs for improved health. We've gone down this road before, and we saw that when we had put them in the region, particularly Ashanti region, we saw the results that we got in the region in the years that we had the youth employment team there working with the hospitals and the CHIPS levels. We know that this is going to be deployed to most of our most sensitive and deprived areas where we can reach people. It also come at a time where we need to improve our risk communication to get people to change their behavior in their response and adherence to the protocol that have been designed to mitigate the effects of COVID. We will also do our best to build the capacity of these community health workers so that they can move on to the next level. And for those who are able to make it and to join our health sector, we are ready to not just waste the capacity and the resources we are wasting in them, but also become part of our team to continue to render services, health services in the country.
But the Ghana Registered Nurses and Midwifery Association is unhappy about these plans. Joining me on Zoom is David Tinkran Chum. He's General Secretary of the Ghana Registered Nurses and Midwifery Association. He wants government to immediately halt the program. David, I'm grateful that you joined us. So what are your reasons for asking government to halt the program?
Hi, my brother. Mr. Free, right? And your viewers and listeners as well. Yeah, I think that Youth Employment Agency have every right to maybe support government in creating jobs for the youth of this country. But we have walked this path before, and we clearly understand the processes. I don't know whether Mr. Free was working with Youth Employment Agency as far back as 2006 when that first model was implemented. I think that in their initial MOU, they were very categorical in the usage of the word community health nurses. I personally, when I read it, I realized that they got it wrong. And I think they have to apologize for the wrong usage of that nomenclature. But be that as it may, what we are trying to say is that these community health workers will end up in a hospital anyway. And besides, they quoted copious ILO conventions and the rest of it. I see a very shallow and pedestrian interpretation of some of these interpretations that is given, because it is country specific. It is country specific because countries that have problems with healthcare in terms of human resource is where you deploy these community health nurses. And that is what the article stipulates, all right? Not when we have trained, highly skilled nurses and midwives unemployed, then you want to deploy community health nurses. The Director General is saying something that, I mean, they will help in education and whatever, or even the Chief Executive Officer. Where were these community health workers when we were fighting the first and second wave of COVID-19, that nurses and other healthcare workers died? All right. What makes you think that somebody who has been trained for 6 months or 4 months can educate the good people of this country better than a professionally trained nurse or midwife? So for us, as far as we are concerned, the reasons that they are used is simply a non-starter. And if they like, they can go ahead. You understand? They have the mandate of the people of this country. They can go ahead and do whatever they want to do. But we are working in the various communities. We are delivering services at the various hospitals. And we think that they will not, or these people will not inure to the benefits of our members. Let me tell you something. I have worked with them for more than 20 years. I'm telling you that sometimes because they are less remunerated, because they are not properly remunerated, they get so frustrated on their job and they vent their spleen on patients and relatives. And you see, anybody who misconducts himself at the hospital, especially if it's a female, they say that the person is a nurse. And these are the issues that we are talking about here. We want quality of care for the ordinary Ghanaian. Okay, so if you have professionals who can run our hospitals and give precise and equitable healthcare, why go for somebody who is half-baked? Okay, look, life is extremely important. So life is extremely important.
So those people are not qualified enough to do the job. That's what you're saying.
I'm telling you that life is extremely important, and the leadership of this country must attach some importance to the life of the people of this country. All right? Because you see, life is only one, and when you lose it, you lose it. All right? So please, we need to be extremely careful. When Barbados was signing an MOU with the government of Ghana, what did they say? They wanted degree and specialist nurses and midwives. Barbados. You see, why do we go back? What I want some of these chief executives of the various agencies to understand is that, yes, we agree that they are doing their best. I mean, they need to help the government to create jobs. But please give proper, sustainable, and dignifying jobs. Not these kind of jobs that is not going to help. No, they can deploy them at various centers. I mean, we have beaches. I mean, there are several beds at the beaches. I mean, there are several things that debris that the sea pour out on daily basis at the beach. They can go and swim there. But look, let us attach some importance to the life of the people of this country.
Thankfully, Kwesi Afriyie, who is Director of Corporate Affairs at the Youth Employment Agency, has joined us. I'm grateful for your time, Mr. Afriyie. First of all, what motivated this kind of signing up of this agreement? Mr. Afriyie, kindly unmute for me.
Right. Right, is it okay now?
Great, loud and clear.
Right, so thank you very much. Let me extend my heartfelt greetings to my brother, David. I've been listening to him, and to answer your question, it's out of need that we are embarking on this project. Basically, it's out of need that we're embarking on this project. If you read our statement, we have outlined a number of issues, particularly including that of COVID. And we have stated clearly that these people are not and cannot be equated to nurses or doctors or even physician assistants. These are people that are going to help in the very rural communities in preventive healthcare. So we are not, as they have stated, adulterating what they are doing. We are not setting people out to be in competition with the nurses. We are not displacing their profession. And so there is no cause for alarm at all. There is no cause for fear and panic at all. And he talks about professionals. He talks about the fact that Ghanaians deserve better. That is why we are doing this, because you go into the very rural communities and you don't have, most of these are doctors who are professionally trained. Most of these are nurses who are professionally trained, even from the areas where they themselves come from. The only way we can help as a youth employment agency is having identified the challenge, having identified the gap. What we're able to do is to try and bridge the gap, not to have a competition of both setups or both the nurses or the doctors or the physician assistants. We are supporting, there have been times, in times past, before these ambulances came, where you heard a lot of stories where in a community or a chief's compound or a community which doesn't have a hospital or a clinic or any setup at all, they have to put somebody at the back of a motor and ride the person to the district hospital or wherever they find a clinic before they find a nurse or they find a health to attend to the person. Somebody who is who needs maybe paracetamol, somebody who needs primary health care before the nurse who is a professional comes in. This is what we are doing. There are sometimes they need training on sanitation. There are sometimes they need training on how to keep themselves and prevent certain kinds of diseases. When cholera breaks out, you don't need doctors who are highly trained, who are supposed to be seated behind their desks, and nurses like my brother David, attending to patients, to also be going out around doing some of these things. Of course, it's their work. But what we're able to do is to train these young people, and mind you, these are young people who have completed most of the times senior high schools, or sometimes even tertiary institutions, and are aiming to become health professionals. So they already have the passion, they already have the interest.
All right, so Mr. Freer is trying to explain, and of course he earlier made the point that there's a clear miscommunication somewhere. So when we get him back, he will try to clarify for us what exactly these people are being trained to do. But Mr. Tinkran, he says they are not coming to compete with you. They agree that these people are half-baked. Some are from secondary school, so there's no way they are going to compete with you.
They can't even dare compete with us. So what I'm trying to say is that they are going to misrepresent the profession. All right. And we need to understand some of these things. Look, Mr. Free, when you fall sick, I'll get some of these community health workers to take care of you. You understand the challenges that I'm trying to lay out here. We need highly skilled people to take care of the good people of this country. That's all what we are saying. We want highly qualified personnel to take care of the good people of this country, irrespective of wherever the person finds himself. You made mention of chip centers and the rest of them. I mean, chip centers are manned by trained, highly skilled
I agree.
and the rest of them. So please, I'm saying that, look, you can deploy them to other centers because they hold themselves as such. I have worked with some, and I'm telling you, for the past 20 years, they hold themselves as such. You will not train and tell them that go and hold yourself like a nurse or something. Look, so many things goes on. They extort money. Look, I don't want to mention it, but I have worked in Koforidua Regional for a very long time. These people, because they are not well remunerated, they sometimes extort money from patients, and it creates a whole lot of mess in the system.
David, you agree?
Okay, David,
please, can you?
I'll not hold you for my people.
Okay, David, let him.
That you mentioned.
Okay, Mr. Free, make your point.
Challenges that you mentioned. Right. So I'm saying that I agree. I'm not holding brief for my people, but you also agree that some of these challenges that you mentioned, it runs through even for the physicians, even for the doctors themselves, even for you, the nurses. There are some of these problems. But what we are saying is that they are not in any way equated to you. What we are doing is a stopgap measure. You look at the Ghana Police Service, for example. We have an agreement with the Ghana Police Service. We know that the recruits we are training are only going to assist in the delivery of security in our country. And you see the community protection assistants, as we call them. Of course, we have stated in our statement that there is going to be the twist of the names, there is going to be a misrepresentation, misunderstanding.
Mr. Free, what exactly are they going to be doing?
Thank you.
So we have stated clearly, and if you permit me, I want to quote the ILO, as we quoted in the statement that we brought out. We said the ILO refers to community health workers as a distinct occupational group, and within the associate services, and provide support. So apart from what we are doing, I'm telling you what the internationally recognized labor organization has agreed or has stipulated for every other country that is recruiting community health workers. So they have stated that we are going to, or they are going to provide support and assistance to communities, families, and individuals within preventive health measures and gaining access to appropriate curative health and social services. This is all they are going to do. And if you look at almost all our modules, our beneficiaries are largely on intention. They are interns. So I stated to you that most of them have completed SS. They are yet to better their certificates and get into the health profession, or for example, the security profession if they are community protection assistants. What we are expecting David and his team to do is to help train them, help let them understand how the practice is, so that when they're able to better their certificates and they come back to school, they will be able to run through as quickly as possible, become a professional like David, my brother, and be able to deliver the quality health service that he's expecting the community health service to deliver to the people of Ghana. Of course, we are not saying that they are going to take care when you need a paracetamol, when you need an antibiotic, they are going to prescribe that for you. No, they cannot, and they are not supposed to. We have not stated that. We are very clear in our mind that that is not their mandate. We are not sending them out to be doing that. So my brother David should not panic at all.
So has the Ghana registered Nurses and Midwives Association been part of this all this while?
Of course, they work with them, with the Ghana Medical Association. I mean, all of these come under the Ghana Health Services. So for us to go to the point of signing an MOU, not just with any mean person or institution, but with the Director General of the Ghana Health Service, who has been at the forefront of this COVID prevention. In fact, when we brought this up, he was very happy. And his whole team were very happy that, I mean, there is a need to expand every effort that will mitigate the impact of COVID. You are in the country, you are a reporter, you have been following this, you have been praising the health professionals and how the country is supposed to contribute in mitigating COVID. So we have met with Dr. Patrick Kumar. We have gone through the processes. We have engaged, and we are still engaging. In fact, we will engage with my brother David as well. And we have signed an MOU with Dr. Patrick Kumar and the Ghana Health Service, not Dr. alone, under the auspices of the Ministry of Health. So, I mean, this is a forward-looking and a forward-thinking program that we are hoping to support health delivery in Ghana. I have read to you, assisting and supporting communities, families, and individuals within preventive health measures and gaining access to appropriate curative health and health services.
Mr. Tinkoran, you've heard him explain this. Have you not been aware of this all this while?
I'm surprised you think this is a brilliant innovation. As far as I'm concerned, it's not an innovation at all. Can you permit me, indulge me?
Yes, sir. Yes, sir. Please go ahead.
You see, and I'm happy you said it is country specific. You see, when the ILO says that train community health workers to augment the workforce or the health sector workforce, or to help in the health continuum. They are talking about areas that they have deficient of supply of healthcare workers. As I speak to you, we have 20,000 nurses and midwives who are unemployed. And you are saying you are going to train and deploy. That amount of money you are going to use to train these 3,000 people and deploy them, use that to employ these knock and nap people who are home, employ the degree nurses, employ community health nurses. What I'm trying to tell you is that we have fought first wave of COVID without community health workers. We fought second wave of COVID without community health workers. What makes you think? What makes anybody, director general, whoever, thinks that it is community health nurses, community health workers that have the answer to the fight against COVID? They are going to use them as sacrificial lambs.
Is this
also when they are not well trained, they are going to be a risk to themselves and to society. That's what I want to tell you.
Is this a concern you've raised with the Ghana Health Service?
Well, we will do that. We issued a press statement. We believe that the Director General has read it, but we're going to speak to all stakeholders. We are not going to work with them. They can decide to train them. We are not going to be part of the training of those people. They can train them. They can use MVTI to train them as they've been doing all the time. But we are not going to work with them. That's what I want to say. So if they can deploy them for them to work on their own, they can go ahead and do that. And who will be responsible? Who is going to regulate them? Who will be responsible for their excesses? If something happens, who will be held responsible? You see, we have to live in a well-regulated system. Nobody can just come and work on patients because there's lack of nurses or midwives. I'm saying that we have avalanche of nurses and midwives who are unemployed. Let us employ them and stop this thing.
So, Mr. Free, are you worried that they are not willing to work with these people you are bringing to offer support?
I mean, no, we are not worried at all. I think what we need to do is to continue the engagement. We are not worried at all. My brother David is a professional, so we very much respect the profession. And it will be difficult to work without them because, as I've stated early on, it is not just about working with them, but also supporting them, training them, giving them a helping hand. And I've stated clearly
we don't need that support. I'm saying that we have enough people who are unemployed, employ them.
I think that's an entrenched position. That's my brother. That's an entrenched position. But what we are saying is that they are not supposed to treat patients. That's not their job. In fact, if you are in the I don't want to give very technical examples, but if you are in the surgical ward, for instance, or they are not even supposed to go to the operation room. If you are in the hospital, for instance, and a nurse, you need some form of assistance. Bring me a scissors. Bring me a tip. Bring me this. Bring me that. If you're asking a community health worker to do, there are hospitals who recruit people who have no knowledge at all to be doing some of these things. And I can cite one or two, private examples to you. But if we train these people for 3 months, and they already have the orientation and passion for health delivery, and they come to support my brother David, I think it's in order. It is only entrenched on my brother's part to say that they are not ready to work with them, but we will continue engaging my brother and his team, and we are very sure and very hopeful that they will be part of this course. And in fact, I have kept referring to the notes. He was talking about the country-specific program. I would say that this is for the whole of Africa. And the whole of the African heads of states at their 29th summit in July 2017 adopted the resolution of the assembly. And in fact, we gave references to all of this in our press release. And they said, recruit 2 million community health workers. They were very specific to assist in the delivery of all the things that I've stated early on. So it is a need that not only the Youth Employment Agency has recognized, not only the Ghana Health Service has recognized, but the whole of the African heads of states, including our president. This was in 2017, including all other presidents here in Ghana, including World Health Organization, including everybody that matters in health. So, in fact, their position is very, very much critical to health delivery, not only in Ghana, but in all other parts of Africa. And there's a document to this, which we have been giving you references to. But I think what our brother is saying is that in as much as we would want to do this, there should be a space to recruit the remaining nurses who are not recruited. So the issue for me is not necessarily about whether community health workers are important or not. Of course, they obviously are very important. But in as much as we do that, My brother wants us to continue to recruit. And that's not the mandate of the Youth Employment Agency. We stated that clearly in our statement. But it is also very important that government takes a look at recruiting every health worker who has qualified professionally into the system. That doesn't displace the recruitment of community health workers. That doesn't displace the importance of community health workers.
All right, so Mr. Free made his point clear there. We're having challenges with his internet. But Mr. Tenkran, so how do you intend to deal with this matter with the Ghana Health Service that signed this memorandum of understanding? And I'd like you to also update me on how far you've gone with addressing the issue of unemployment for the almost 20,000 nurses you talk about who are sitting at home.
Of course, we are in constant touch with the Director of Human Resources. I must say that he's doing a very fantastic job. Director of Human Resources of Ghana Health Service, Ministry of Health, they are doing fantastically well. He's trying to help us to be able to secure financial clearance from Ministry of Finance for our people. What Mr. Free is saying, he doesn't seem to understand me. When you attend Africa Health Summit or whatever, and they ask you to employ 2 million community health workers, when you have qualified people there, qualified health workers, you don't. Where are they drawing their budgets from? Where are they drawing their budgets from? Is it not coming from the consolidated fund? So is it a different budget they are using to pay the people? So you see, I'm saying that it is country specific. So if that you don't have that challenge in your country, you don't adopt it. All right. The fact that you have signed to it doesn't mean that compulsorily you have to implement it, because you have several nurses and midwives who are unemployed. Employ them. Okay, so yes, Nigeria may sign on to it because they don't have that number of nurses are unemployed. And other countries, look, I was the president of West Africa Health Sector Union, WASUM youth president. And several West African countries have serious shortage of nurses and midwives. We have trained nurses and midwives. They are even exporting some to Barbados. They want more qualified nurses and midwives. And you want to bring community health workers when we have avalanche of nurses and midwives at various categories, those with certificate, those with diploma, those with degree, languishing at home, which is leading to de-learning, okay? Because, you see, nursing and midwifery are skill acquisition program. When you go to school to acquire a skill, it's not theoretical. So when you stay at home for a very long time, you become stale. And what happens is that it leads to de-learning. Employ these people so that they can fill in the gap. Just say that you're going to bring all set of new people who are half-baked, who are going to create more problems.
How do you intend to deal with this challenge? Because it looks like the thing has already been signed with the Ghana Health Service.
Oh, it's not a problem. They can sign it. But when we get to the bridge, we shall cross it. You see, we don't need to create confusion in this country. We need to work in peace. I believe in industrial harmony. If something is working, let it work. Don't compound the problem. I'm saying that if the Director General is saying that it is the community health workers who come and fight COVID, then I can't comprehend that. When we have fought COVID during the first wave and the second wave, and everybody can witness that, what makes you think that it's community health workers who can fight COVID? As far as I'm concerned, they are going to be danger to themselves and to society, because half knowledge is dangerous.
I'm grateful for your time. David Tenkran is General Secretary of the Ghana Registered Nurses and Midwives Association. We're joined also by Kwesi Free, who is Director of Corporate Affairs at the Youth Employment Agency.